Aloha and good morning, everyone. It is 9:04 a.m. on Thursday, October 24, 2024, and I call the Committee on Public Safety meeting to order. In the Council chambers today, I would like to welcome Councilmember Dos Santos Tam. Committee Vice Chair Tolba is excused from today's meeting. Also joining us today via video conference, I'd like to welcome Councilmember Tupola, who will be remotely participating. And if Councilmember Tupola, aloha, thank you for turning on your camera. Councilmember Tupola, in accordance with Section 92-3.7 Hawaii Revised Statutes, please identify each person who is with you at your location.
Aloha, Chair. I'm here alone. Thank you.
Thank you, Councilmember Tupola. Pursuant to Section 92-3.7 Hawaii Revised Statutes, this meeting will be conducted as a remote meeting by interactive conference technology with the following procedures in effect for the meeting. Members of the public will be allowed to provide oral testimony on all items on the agenda in the following order: in person in the council chamber and remotely. In person and remote oral testimony will be allowed when each agenda item is taken up. Before testifying, each person shall state their name for the record. Each speaker will be limited to a 1-minute presentation on each item. All persons who have registered to testify in person will be called upon first. When your name is called, please proceed to the podium. When the timer goes off, please conclude your remarks promptly. Persons who have not registered will be given an opportunity to testify following the registered testifiers. I will then proceed to remote testimony via video conference or phone. When your name is called, please monitor your screen and activate your audio feed when prompted. For those who are joining us by telephone only, I will identify you by the last 3 digits of your phone number. When your number is called, please listen for the prompt to unmute and press *6. Persons who have not registered to testify remotely will be given an opportunity to offer testimony. To indicate your desire to speak, please use the raise hand feature in Zoom or press *9 on your telephone. Some friendly reminders and tips: video conference from a quiet location if possible. If you're also watching the proceedings on Olelo, please mute your television at the time you're called to testify. When the timer on screen reaches 0, please conclude your remarks promptly. HRS Section 92-3.7 requires that all votes at remote meetings be conducted by roll call unless unanimous. Therefore, I will first call for objections, and if there are any, I will call for a roll call vote. For those members participating from outside the council chamber, in accordance with HRS Section 92-3.7, the meeting will automatically recess if we lose audio-visual contact with you, and we cannot reconvene until we reestablish contact. Therefore, please notify me if you will be leaving the meeting, even if only for a short period of time. Written testimonies, including the testifier's address, email address, and phone number, will be available to the public as described on the posted agenda. As courtesy, please turn off all cell phones for the duration of this meeting. Mahalo. Moving to agenda item number 1, Resolution 24-260. This resolution accepts a gift to the city valued at $66,000 from Olukai of approximately 900 pairs of footwear for use by the Honolulu Ocean Safety Department lifeguard personnel. And with us, I believe today we have Assistant Chief Adam Lerner from Honolulu Ocean Safety Department. Good morning, Assistant Chief Lerner.
Good morning, council members. Sorry about that. Yes, Lieutenant, TA Assistant Chief Adam Lerner with Ocean Safety. And we're happy to accept the gift from Olukai. They've been very generous to us over the years, and yeah, they've helped us for many, many years. They graciously give us shoes, slippers. We kind of look at it as test pilots for their product, but they give us approximately 300 pairs of shoes. We have about 270 lifeguards on Oahu, and they also throw in a couple pairs of slippers. And over the years, they've supported all kinds of different aspects of ocean safety, our junior guard program and whatnot, but very happy to accept this gift. They've been generous and grateful.
Thank you, Assistant Chief Lerner. Members, are there any questions for TA Assistant Chief Lerner? Okay. Thank you so much. Seeing no further questions. We will now proceed with in-person testimony. Clerks, do we have any registered or non-registered in-person testifiers?
Chair, there are none.
Thank you. We'll now proceed with remote testimony. Clerks, do we have any registered or non-registered remote testifiers?
Chair, there are none.
Thank you. Members, we are in discussion. Okay, seeing no further discussion, the chair recommends that Resolution 24-260 be reported out for adoption. Any further discussion, objections, or reservations? Hearing none, so ordered. Thank you, Assistant Chief Lerner. Moving on to agenda item number 2, Bill 55, 2024. This bill relates to the adoption of the 2021 State Fire Code. Members, please note that we posted on the agenda a proposed CD1 to this bill, OCS 2024-0937/10/17/2024, 3:25 p.m., and a summary of the amendments was also listed on the agenda. With us today, we have from the Honolulu Fire Department, Battalion Chief Pao-Chi Huang. Good morning, Battalion Chief Huang.
Good morning, Committee Chair Okimoto and committee members, and also Councilmember Tupola. I'm Battalion Chief Pao-Chi Huang with the Honolulu Fire Department. We're here to support of Bill 55. The department appreciates the work Committee Chair Okimoto and her staff have done to clear up some of the language with Bill 55 with your CD1. The department supports these changes proposed in CD1. I will be happy to answer any questions you may have regarding this bill.
Thank you, Battalion Chief Wang. Members, do you have any questions for Battalion Chief Wang at this time? Okay, I just have a couple of questions. You know, on page 3 of the bill, the bill references the Fire Plans Revolving Fund. However, this fund is not cited in the operating budget booklet or in the budget worksheets. Are these funds accounted for in the Special Projects Fund? And if so, about how much does the department collect annually for this fund? And I can refer you to the operating budget booklet, pages B111 and B114, and the budget worksheet pages 261 to 265.
Thank you for the question, Committee Member Okimoto. It is a special fund that I'm aware of where plans review is deposited in. I do not have the specifics as far as where it goes in the city budget. I do know the funds are specifically earmarked for in the language when it was adopted for fire prevention, fire investigations. So it is used for that in the fire department. I will have to get back to you what funds it goes to.
Okay, I would really appreciate that. Did you want me to reference the page numbers again? Or
Yes, please.
yeah, okay, so the operating budget booklet pages B111 and B114, and the budget worksheets pages 261 to 265. And that's on page 3 of the bill itself.
Okay, thank you for that. I'll work with your staff.
Okay, thank you very much. And I just had another follow-up question. If you could provide us with some timeline. I know that this legislation passed the state legislature back in January 2023. Could you provide a timeline of what happens after that? This has to be updated every couple of years. When was the state fire code adopted by the legislature, and when did the department then take action since it passed in that 2023 timeline that I provided?
Just to clarify, you're talking about the state fire code? Okay. The state fire code typically is adopted every 3 years. The last time it was adopted was it was January 20th, 2023. They're currently in the process of adopting a new state fire code. The Honolulu Fire Department typically will adopt the state fire code with amendments within 2 years of their adoption. So we typically will work with them to kind of like follow them.
Okay, thank you for sharing. So since that happened in January 2023, it was a timeline. Now, if I recall, the council didn't get any notification from the department until about September. So could you give me a timeline of what happened between January 2023 until September 2024?
Yeah, so we've been working on this on an ongoing basis throughout the years. So we do follow a process, and it was ready in September.
And so we understand, you said every 3 years this changes, but so we're on a timeline right now
That's correct.
for 2025, correct?
That's correct.
So if this doesn't go through, then what happens? In the time, we just received this in the council September, which is
Yeah,
a
so,
month ago.
The way it works in state law is that if the city and county does not adopt the local code with our amendments, then the state fire code is adopted without amendments until we pass the city and county fire code.
And in the past, what was the timeline for the department to get it to the city council?
I am unaware of a timeline. We just try to work to try to get it in before the 2 years deadline.
Okay. I appreciate you answering the questions. I think what I'm not alluding to or focusing on is what could have been done more efficiently, because now we're crunched for time. And I know that you've been working with my office, and my office has been working with OCS to make sure that we get this done. But in the timeline we're given, I'm worried that it may not come to fruition. So I'm trying to think of in the future, how could we do this so this more in a timely manner and that everything is done before the deadlines are
I really
lapse.
appreciate the question. It is currently being addressed. So I am the battalion chief for Fire Prevention Bureau. I am the one responsible for this. We've already identified this as an issue. We are definitely working on it to make this a much faster, more efficient process.
Okay. Thank you, Battalion Chief Wang. Members, are there any further questions?
Chair, I have a quick question.
Yes, Councilmember Tupola, thank you.
When you were asking him about how much is in the fund, what special fund were you referring to?
That was the Fire Plans Revolving Fund on page 3 of the ordinance.
Fire Plans Revolving Fund. Oh, I see. Okay. There's some revolving funds inside the BFS annual report, but I'll look into it. And then I thought it was a good question. I just had never heard of that fund before. Thank you.
Okay. And did you want, when the department gives us the information, would you like us to also share that with you?
Yeah, I mean, we can reconcile because the BFS annual report is from, year to year, but knowing how much is in there would be interesting from their perspective, and then we can reconcile with BFS's report. Thank you, Chair.
Okay. Thank you, Councilmember Tupola. Councilmember Dos Santos Tam?
Actually, I do have a question. While we're on the topic of various fees, there are a number of fees for permits in pages 2 and 3 of the bill. Does the department feel that these fees are appropriate, whether because of the work required to issue a permit to analyze the situation, et cetera, whether some of these are too low or perhaps too high?
Thank you for the question. These fees have been in place and have not been updated for many years. I could not give you an answer specifically to whether they're too high or too low. That's something we can look into. It's a discussion we could have. I guess I can look into it and I can get back to you, sir.
Yeah, we'd appreciate that. Just, one of my things has been updating kind of older ordinances. And obviously, we want them to be reasonable because we want people to apply for the permits and we don't want that to be an obstacle. But if it turns out that it requires, one of your inspectors a full day to look into, or perhaps a full week to look into it, and we're only charging $100, we might want to look into that, depending on what the specific permit is.
Thank you for that. I will bring that up with our executives, and then we can discuss whether that is an issue for us.
Thank you. Thank you, Councilmember Dos Santos Tam. And Battalion Chief Wang, if you could, these questions that have been posed by the members, I know that we're asking them a la carte, but if you could send them the responses to all of our offices, that would be really appreciated. Any further questions, members? No? Okay. Thank you. Thank you, Battalion Chief Wang. We'll now proceed with in-person testimony. Clerks, do we have any registered or non-registered in-person testifiers?
Chair, there are none.
Thank you. We will now proceed with remote testimony. Clerks, do we have any registered or non-registered remote testifiers?
Chair, there are none.
Thank you. Okay, seeing no further testifiers, members, we are in discussion. Is Councilmember Dos Santos Tam?
Yeah, Chair, I just noticed there's a few kind of minor and miscellaneous technical things in here that I know I'm sure the OCS people will eventually catch. On page 7 in subdivision 12, we try not to use fractions, so it says 1.5 feet. The next one is on page 8, subdivision 15. It says each fire department connection shall be designated with a sign with contrasting letters at least 1 inch in height that reads, and then there's nothing that it's supposed to read. And based on the old fire code, it should say standpipe in big capital letters. And then the last one is on page 11, subdivision 20. In subdivision 20, there's these brackets around 72, 10, 20.2. That doesn't appear anywhere else. So I don't know if that was supposed to say NFPA 72 or something. It's strange that it's in brackets and just sort of an orphan reference.
Okay, could you repeat that? Did you get it?
Yeah.
You did? Okay. Thank you, Councilmember Dos Santos Tam. Thank you, Councilmember Dos Santos Tam, as well as thank you, Kyle. Members, any further discussion? Okay. Seeing none, and we have the changes that you mentioned noted. The chair recommends that Bill 55, 2024 be amended to a CD1. Any discussion, objections, or observation or reservations? Hearing none, the bill has been amended to a CD1. The chair then recommends that Bill 55, 2024, CD1 be reported out for passage on second reading and scheduled for a public hearing. Any discussion, objections, or reservations? Hearing none, so ordered. Thank you very much, HFD. Moving to agenda item number 3, resolution 24-244. This resolution authorizes the use of overt video monitoring in the city and county of Honolulu to prevent and deter general criminal activity and achieve the legitimate law enforcement objective and legitimate public purpose of ensuring a safe and secure 2024 Honolulu Marathon event. Members, please note that we posted on the agenda a proposed CD1 to this resolution, OCS 2024-093-8/10/18/2024, 6:53 a.m., and a summary of the amendments was also listed on the agenda. With us today, I believe we have Acting Director General Jennifer Walter from the Department of Emergency Management. Good morning, Acting Director Walter.
Good morning, committee chair and members. My name is Jennifer Walter. I'm the acting director of the Department of Emergency Management. This is an annual request we make to allow for temporary use of video cameras during the marathon in the interest of public safety to allow law enforcement to monitor for any dangerous acts. And so we support this resolution. Thank you.
Thank you so much, and we're happy to have you here. We know that we do miss Director Toya, but so thankful that you've stuck around and are happy to work with you.
I miss him too. Thank you. I appreciate it.
Thank you, members. Are there any questions for Acting Director Walter? Okay, seeing none, thank you, Acting Director Walter. We'll now proceed with in-person testimony. Clerks, do we have any registered or non-registered in-person testifiers?
Chair, there are none.
Thank you. We'll now proceed with remote testimony. Clerks, do we have any registered or non-registered remote testifiers?
Chair, there are none.
Thank you. We'd like to welcome to the chamber Councilmember Say joining us. Thank you for being here with us. And seeing no further testimonies, members, we are in discussion. Yes, Councilmember Dos Santos Tam.
Sure, thank you. I really appreciate that the second to last, be it further resolved, talks about DEM submitting a plan to us about how these cameras are going to be used after the event. I look forward to having the report. I don't think we've included this in previous resolutions authorizing video monitoring, so I think it'll be really helpful for us to understand these plans, and if they do stay in place for traffic monitoring, hopefully that makes traffic better along the route.
I agree. Thank you, Councilmember Dos Santos Tam. Members, any further discussion? Seeing none, the chair recommends that Resolution 24-244 be amended to a CD1. Any further discussion, objections, or reservations? Hearing none, the resolution has been amended to a CD1. The chair then recommends that Resolution 24-244 CD1 be reported out for adoption. Any discussion, objections, or reservations? Hearing none, so ordered. Thank you again, Acting Director Walter. Members, moving to agenda item number 4, Honolulu Emergency Medical Services, EMS billing retention and unit closures. And joining us in the council chamber this morning is Director James Ireland from the Honolulu Emergency Services Department. I also see Deputy Director Ian Santi. Thank you for being with us. They will be providing a brief presentation for your information. The presentation is available online as Departmental Communication 762-2024. Good morning and aloha. Deputy Director Ian Santi, as well as Director James Ireland.
Good morning, Chair, committee members. Again, Deputy Director Ian Santi and Director Ireland is with me. Today, again, as requested on our informational briefing, we're going to be talking about our Emergency Services Department billing. We're going to provide you some statistics and show you some information. Just wanted to start with this. Currently today, we have 30 positions in our communication center and 259 positions in our field operations. That is our uniform position. That does not include administrative and support staff. But just to show that as of today, right now, we have 9 vacancies in our communication center, and we are looking forward to an open recruitment for that, as well as we have 12 vacancies in our field, and that includes our 17 recruits that will be graduating in the end of November. Having a, technical there. This slide shows what our current transport volume is for the last 3 months of this fiscal year. So in the month of June, we had approximately 9,000 calls that we respond to with all 21 ambulances on the island of Oahu. Of the 9,000 plus calls, 4,900 of them are transported. And that shows a continued average for every month that we normally do. This shows our average response times, and our wall times. Our response time is all our ambulances averaged together takes on approximately 15 minutes to respond from the time the 911 call comes in to the time the ambulance arrives at the patient's side. And our wall time is the amount of time that our staff is spending upon arrival at the emergency room and waiting to patient care transferred into the emergency room. So as you can see, it's not a quick 5-minute turnaround. It takes somewhere approximately 20 minutes for our crews to offload a patient in the emergency room. This is the total revenue received by this city, starting with fiscal year 23, where we had the transfer over from the state to the city, through fiscal year 24 and then fiscal year 25. This is very specific to the amount of money that came into the city, which is approximately $50 million over that 3-year period. As you can see in fiscal year in 23, that was our transition year. We went through the open procurement process through a sealed bid to get a billing vendor, and we were able to start billing at the end of approximately August of 23. So that's why you see a little bit of the low money coming in there, low revenues coming in there, and then majority of it coming in 24. So 24 is a double of both 23 and 24. As with any billing, as we do with our personal medical, an individual may get a bill in January but not pay it till March. So there is some crossover, but we do keep track of when the individual is provided the date of service, and then we also when the money is collected. And then this is also revenue that we receive from the state. So in the transition period that we receive, in the transition period of the transfer, the state gave a decreasing amount of support, knowing that there would be some delay in us getting our billing program up. In the fiscal year 23 and 24, that was approximately $20 million that we received for those 2 years from the state, and in perpetuity, we are continually receiving $3.5 million from the state to support this system. And then now also to talk about our billing also, we also do receive records funding. Any individual that comes and requests a copy of their ambulance report, it's per ordinance, it's charged at $5. So this is not a lot of money. It's approximately $2,300 for the entire year, but this is how many reports that we provide to individuals requesting copies of their medical record for various reasons. This slide just demonstrates what our record staff is doing. So externally, we have a contract with our billing company that handles review and coding and distribution of the bills and other concerns or complaints related to an individual's bill. However, internally within our department, we have our own billing and customer service staff that addresses things that need to be processed locally for us to support our community. This is just another providing you more data and information of the other activities that our records and our billing company does. Everything from emails to phone calls and dealing with also complaints and then hardship requests and questions. And this shows you just our quarterly stats of other individuals, the type of breakdown where we get calls from the mortuary to confirm somebody's death or other organizations requesting copies of records. This slide demonstrates now in hours the amount of leave that our individuals within the EMS division that are uniformed on, as I'm going to talk about, and the amount of overtime hours that we produce per month as we talk about our unit closures. So this is our unit closures based on shift comparatively from last year to this year. As you can see, there's a dramatic decrease in the amount of unit closures we had per shift. So an example would be in the month of January, there's approximately 1,260 shifts. This past January, we had 17 shifts that were closed. And we are available for any questions. I know I went through that pretty fast, Chair, but open to any questions that you or the other committee members may have.
Thank you very much, Deputy Director. Members, if it's okay with you, I had some questions I want to start off with, and then we can take turns after that. And it could be to you or Director Ireland, if that's okay.
Yeah, correct. Either one of us can come and answer. And do I need to take off the share, or it's good like that?
I think we can remove, I'm not sure how.
Oh, yeah. We'll just leave it for now, or ask your staff.
I think you can take it. Well, yeah. Okay. OCS reported a variance of almost $30 million for fiscal year 2023. I know you had a slide on the billing that came in. Your communication D-706 states that $12 million has been collected for fiscal year 23. To be simple, how likely is the city to receive the missing $18 million? So again, OCS reported to us a variance of almost $30 million for fiscal year 23, which you did mention that was the period where there was a transfer of coming from the state to us. But in your communication, it says that $12 million has been collected. So how are we going to address the $18 million that was not collected in fiscal year 23?
So that again, that money was collected in fiscal year 24.
So can you repeat that again?
That revenue was collected in fiscal year 24. As I said earlier, maybe we can bring that slide back up, or I'll try and see if I can bring that slide back up. Sorry, I might need somebody to bring. So again, as what happened in August of 2023 is when we were able to initiate the first bills. The bills went out, and that was already within fiscal year 24. Fiscal year 23 ended on June 30th. So we weren't able to send any billing out until fiscal year 24. So fiscal year 24 went back the full year from August of 24 to August of 23 to actually, August of 23 to August of 22 to bill out those individual patients.
Do you have an idea of what was collected prior to the transfer? So you're saying in 2023 it dropped and you collected in 2024. What are we comparing it to before? Like in
No, I'm not saying
2022
that it dropped.
I'm
saying
asking, well, in this slide, that's what was stated, right? The collections dropped.
we're
in
saying that we
23.
didn't collect anything because we didn't have a contract.
Okay, so prior to that, what I'm trying to get to is what was collected prior to the current contractor that we have, prior to the city taking over from the state?
That would be information we'd have to get at the state. As we discussed this, it was around the $25 to $27 million range.
25 to 27
Yeah,
million.
so
Okay.
and that was probably years before as this was discussed in progress with the state. So I don't have that information with me, and we can try and see if we can get that from the state for you.
Okay, so if you're saying that in 2023 it wasn't collected, 2024 we collected the missing, then we should have collected over 60 million in fiscal 24 to cover what wasn't collected in 23 as well as what should be collected in 24. Correct?
Yes, approximately. And then when the council communication we sent, I think we sent the council communication that said we collected approximately $70 million over that 2-year period.
The fiscal year
23, 24.
24.
Yep, so that's the council communication, I think you mentioned, in addition to the state revenue. So the state alone in 2 years provided $20 million, and we collected $50 million.
$50 million?
Yep.
I'm looking at the numbers that I have. Communication refers to about $20 million in funding from the state, which you talked about, during fiscal year 24, which indicates the vendor only collected about $19 million for fiscal year 24.
I apologize, maybe we're not looking at the same thing because that's the memo that we sent over, Chair, prior to this meeting.
Did you get that memo that he's talking about? Can you repeat those numbers again in your memo that you said was sent?
The memo we can probably,
You said 70 million
yes,
collected state and the
state
city.
and city funds combined. So let's try to look back up at my slide here. And I can't really see it, but you see where it has the gray area? The gray area says 12 million on the first big gray, and then the 7 million on the first one there. That's the state funding that we received from the Department of Health for this transition. And then you have 44 million in the big blue, so that's approximately $64 million.
Okay, thank you. I'm trying to look at the numbers right now.
And then the last blue is our approximately 10 million as we
So for
started
fiscal
this
year
fiscal year.
25, it's 10 million.
Yes.
I guess my number, I'm looking at this and I'm calculating that it should be around 20 to 30 million for fiscal year 25. And you have it at 10 million right now.
Maybe we can have a separate side conversation with you to explain it in more detail because the fiscal year 25 just started in July. So our average collection per month is 2.5 to 3 million. So we've run July, August, and September. So we feel that we're on track with what we said in the sense of the collection.
At 10 million.
Yes. I'm not sure why, if you can explain why you would feel that it should be 20 million.
Well, and we can, again, clarify the numbers later, but I'm trying to understand the discrepancies between what was collected before, what we have now, and moving forward to make sure that we're collecting
Yes.
the revenue that we should be collecting.
The major discrepancy in fiscal year 23 was we didn't have a contract. So it took approximately over 6 to 9 months to get the contract. So at that point, we couldn't send out a single bill. But now we have a
But
contract.
you said it was collected in 24.
Yes.
Okay. How much of that was it all, but the majority of it collected? I know that with.
I don't have that data in front of me. We can definitely provide that to you.
Okay. And you mentioned the state subsidy. So after fiscal year 25, you said in perpetuity, it's 3.5 million?
Yes.
Okay. Are these subsidies intended to pay for transports in lieu of Medicare and other insurance companies paying their share?
No.
No.
The subsidy is there to support the system. There is this to support the system of EMS. The subsidy that the state is providing us is actually the vehicle registration tax that the state has added on, which is a $5 per charge for every vehicle in the city and county of Honolulu.
Can you repeat that? Vehicle registration?
Vehicle registration tax. So every one of us that has a vehicle that we register, each vehicle is additional $5, and that funding is provided to the city and county of Honolulu via this Act 208.
Okay. do Medicare MCOs and Medicaid MCOs pay full charges to do, or do they pay at the respective Medicare and Medicaid mandated amounts?
James Ireland, Director, Emergency
Aloha,
Services. I'm gonna take
Director
my turn
Ireland.
now. Going back to just some of the parts that are unclear. First of all, when we were first going over this with the state and discussing how the fund would taper off, they were initially planning to give us 0 subsidy beyond this year. And our argument 3 or 4 years ago was if Oahu drivers are paying $5 on their car registration to go towards EMS, we didn't feel that that should go to the state necessarily to fund EMS in other counties, because those drivers pay their $5 on their fee or whatever it is. I don't know what it is on the neighbor islands, but we felt pretty strongly that that money should stay here on Oahu. And so that was the reason why we negotiated that $3.5 million for the Oahu cars. That $5 stays on Oahu to support EMS operations on Oahu. With respect to the billing, unfortunately, just the way billing is, if you get an ambulance ride or trip to the hospital, treatment by the paramedics in July, there's a delay, and when the paperwork goes, you get the bill and pay the bill. So we're always going to be anywhere from 30 to 90 days from collecting the money. So there's this lag. And I think what you were referencing, the paucity of money in 23, I think from that one slide you could see we actually collected more than we probably would have collected in 24. And that really reflects bleed over from 23. And also that was the purpose of the decreasing state subsidy, because they knew we would have a delay in billing where we may lose some revenues. So those state subsidies were higher in the beginning. With respect to your current question, we right now follow the state billing guidelines. We just use the state EMS billing guidelines, and currently it's about $2,400 per trip to the hospital by our paramedics. Unfortunately, government-based insurances will just pay what they're going to pay. They're not going to pay the full $2,400. So Medicaid and Medicare are significantly lower than that. Medicare is somewhere around $500, and Medicaid is even less.
That's out of the, sorry, $500 out of the $2,400?
Out of the $2,400 bill, right. And so really, through council, we could potentially raise the bill higher than the state rates, through council, but it really wouldn't generate a lot more revenue with respect to the government-based insurance. Maybe with the commercial-based insurances it would, no-fault insurance from auto accidents and workers' comp. But the vast majority of our bills are Medicaid and Medicare. Medicare's federal government, you're not going to get any more money out of them. Medicaid, there is, I think, some wiggle room through potentially the state legislation. We could potentially get a higher bill for EMS trips with them, and that will be our lobbying efforts with them.
Before you go too much farther, because I want to go back to something you just said. So you said a 30 to 90-day lag between billing and receiving the payments.
Correct.
But some have gone longer than that.
Well, sure, and then there's always the chance that people don't pay the bill or it goes to collections and this sort of thing as well.
Do you have the amounts of what that equals totals?
Do we have it today?
Not today.
We have it, but I don't have it with me today, yeah.
Could we receive that? I'd
Sure.
like to know how much we are not actually collecting.
Sure. And then the other thing too is we do have a mechanism for hardship for local families that for whatever reason don't have the resources to pay their bill. We're not going to make somebody go without food to pay their ambulance bill if they're already below a certain poverty wages or a certain I don't know how to describe it. Yeah, so we're not going to make someone forego paying their rent or eating to pay an ambulance bill. So we do have a forgiveness program for local residents.
Okay. And you mentioned the contract that you said that because there was no contract for a certain time and then there was a contract. What kind of contract does ESD have with its current vendor? Is it a year-to-year contract? What are the stipulations of this
the
contract?
current contract was done through a RFP back in 22, and it is an annual contract with 5 annual extensions up to 5 years.
Annual contract with
Extensions.
And you said 2022. That's
Yeah.
when the contract began with the vendor.
No, the contract began in that's January of 23 is when the contract began. So they have 5 annual extensions after the first year.
5 annual extensions. Okay. And does the vendor have any experience of working? The current vendor have any experience working in Hawaii?
The current vendor does not have current experience in Hawaii. if that was your question.
Okay. Yes, that was. And okay, so you mentioned in 2022, what part of 2022 was the RFP or the billing contract awarded?
The billing contract was early 22. I can get you that information. We have a whole timeline that we can provide to you.
Okay.
We can send a memo to the committee if that's okay, Chair. That explains
Okay.
that.
I think in my
ju-
notes I have October 2022.
Yeah.
But why is it that they wouldn't have been started? You mentioned the billing, the lapse. So why did they not start billing until July 2023?
As part of the process, the city and county did not have a Medicare number, so we are not authorized to bill. So we did not get a Medicare number authorized to us until January of 2023. You have to go through the process to be authorized by Medicare to bill insurance companies.
When did the department know that we would need a Medicare number after the agreement that was going to be transferred from the state to us? How much time lapsed?
We knew that prior to that, if this was transferring, we would need a Medicare number. However, the city could not do a procurement until the actual time that the state transferred over to the city. So we could not apply for a Medicare number until a billing company was awarded.
And that took how long?
The procurement process, off the top of my head, it went approximately 6 to 12 months. We did an RFI and an RFP, and we'll be more than happy to share with you our timeline process of all of that.
So 2 years. It took about 2 years.
From the time that we started the process knowing that we were transferring, probably 1.5 to 2 years, I guess you could say, but I would have to get the exact information
And in
for
that
you.
time period, there was no billing or collecting happening because we didn't have a Medicare number.
There was no billing and collecting happening from July 1st of 2022 until June 30th of 2023.
I think my concern is the bill passed. We knew the bill was passing. We knew that we would have this, we would require this. I don't understand why it took 1.5 to 2 years to get the Medicare number, then requiring us to lapse collecting of funds.
Again, we could not apply for a Medicare number until the contract was actually established with the vendor. So the vendor it took approximately 6 months alone just to get the contract issued out to the vendor.
What was the process for getting the current vendor if they had no experience in Hawaii?
What was the process?
Yeah, you said 6 to 12 months or
So
what?
we did a request for information. A bunch of vendors turned in their information, and then we sent out a request for proposal, and then that was reviewed by an internal committee to review and select a vendor, all worked through the Department of Budget and Fiscal Services and their purchasing division.
And that took the 6 to 9 to 12 months, is that?
Approximately, yes.
Okay. Members, did you have any questions? Councilmember Dos Santos Tam.
Thank you. So I just want to get a few things sort of clear. So under the state, the last year in which the state fully took care of all of this, we were getting, how much were we getting in that year, FY22?
We were getting nothing with the general fund.
The city general fund got $46 million from the state.
In FY22.
In FY22, correct.
And then, so that's gone down effectively since then. And so our goal is to get it back up to where it is, and that's why we have this vendor. But based on this sort of net revenue chart, if you add everything up, you know, our average collections in FY23 and 24 or just FY23 and 24 is about 30-something million, which I think is what you guys estimate.
Average, correct, yes.
Average. And so we're still getting less than we were when the state took care of everything.
Correct.
Right? So how much is outstanding? Like, how much do we have left to collect if we're below collections below what we would have gotten from the state in 23 and 24? There must be outstanding amounts.
There are outstanding amounts that are referred to collections, and I think Chair asked for that report, and we can provide it in writing.
I think that would be really helpful for us to understand. And I guess what this is kind of getting at is, you know, we have this billing vendor. Chair Okimoto asked about, you know, them getting a Medicare number and all of those other things. But what are some metrics that we can really look at to understand their performance? How can we make sure and help you make sure that this vendor is being very effective and, you know, doing their job? Like, we want to get back to where we were at the very least under the state.
And
hopefully.
I think Chair asked that question. So if we're able to get we're going to send a request over to the State Department of Health and ask them to provide the data to show what was the billing vendor producing for the city and county prior to the state transfer over. And I think, as I mentioned, I believe that it's approximately $25 to $27 million. So as far as the collection goes, the collection that we're getting is equivalent to the money that's coming over, but not as far as the actual state contract, it is a lot less, correct?
Okay, great, thank you.
Thank you, Councilmember Dos Santos Tam. Councilmember Say.
I just wanted, Madam Chair, I just wanted to congratulate the director and deputy. It was in 2021 that we started the journey in regards to the transition from the State Department of Health to the City and County of Honolulu. And I think the council was on top of them in regards to getting them to do the RFI and the RFP. But more importantly, going and looking out in the out years, looking at the clientele, I'm a little concerned that we're pushing more of the funding or the revenues upon the private individuals. And, you know, that's individuals like you and I that private insurance would be paying for it, correct? And the concern would be just that if that's going to be a case whereby it's going to be shifted more to private individuals and private insurance premiums, those premiums are going to go up too, which affects the overall general public who, you know, is law-abiding as far as not applying for Medicaid or Medicare. I don't have the answers, but do you feel comfortable that in the next fiscal year that you'll be solvent enough and not make a request for any transfers of general fund monies?
Thank you for that question, Council Member. You know, one of the things I think it's worth pointing out, since we took over from the state, we have actually added a significant amount of service. Eva Beach now has a 24-hour ambulance, where under the state they did not. Makiki has a 24-hour ambulance now, with under the state they did not. We added a supervisor to cover Waipio, Mililani, Wahiawa, and the North Shore with a rapid response SUV, and prior, and under the state we did not have that. We have added a rapid response SUV to cover from Makakilo to Makaha, and in town if needed. That response unit's very mobile. We've added a basic life support ambulance in the Kalihi area. So there's quite a bit more service now as compared to when we took over from the state. And that's one of the things we wanted. We wanted the flexibility to meet the challenges of the increasing call volume that we're seeing, you know, island-wide. Now, with respect to your question, you know, unfortunately, all of medicine is to some degree on the backs of commercial insurance, because Medicare and Medicaid just don't pay to cover, and that's for physicians, that's for hospitals, that's for ambulance, that's for everything. One of the ways that we can increase revenue, and we're looking at, and again, this is going to require council partnership and discussion, is treat for no transport. And this is authorized by Medicare. And it's when we go, and I know we had a slide up there that showed you something like 30 or 40% of the calls we go on, we don't take the person to the hospital. That we treat them at the scene, we assess them, we may splint them, and then they go, either they don't go to the hospital or they go in a private car. Currently, we don't bill for any of those services, but we can. But again, we would need partnership and discussion with the council and public input as well. And it wouldn't be a $2,400 charge like a trip to the hospital, but if a paramedic comes to your house and gives you drugs or a medicine and you're better, you don't need to go to the hospital, there should potentially be a charge for that. If we go to a car accident, we check the person out, we give them advice, we splint them, but they don't go to the hospital, potentially there could be a charge for that. So I actually look forward to discussing this more with this committee and this body as a way to potentially generate more revenue for the city, cover our services, but at the same time, not put this on any one entity that's maybe too much.
Okay, thank you very much.
Thank you, Councilmember See. I did have questions on a couple of the other topics I had you come and report on, but I do want to say that that's our goal as well, what you just stated. We're trying to figure out what we can do on our level to help out the department to ensure that when you guys go out and do calls, that you have the resources you need. And if there's any way that the revenue that should be generated isn't coming in, you know, we want to see what can we do to address that. If you could, as you stated, get us the reports the data, because I would like to see those discrepancies in the numbers that we're looking at. That would be really helpful. Yes.
Can I just get one clarity? So can you just re-summarize what you want exactly so we're all on the same page?
Yeah, so I had questions about the amounts that you're saying you're collecting and what you should be collecting. I know the graphs have information on here, but I guess the numbers that I was looking at varied. So I'd like to see, and I think Councilmember DeSantis asked something similar to what I wanted to know. What was being collected prior to the transfer from the state to the city? Because it should be the same, if not higher, where, 3 or 4 years later. So those amounts should be higher, and if not, why is that, and what can we do to fix that? Okay. Thank you. I did have, and thank you again for coming. I had you come on multiple issues. One of the things that I wanted to discuss also was the retention and retainment. So in your slideshow, I think you had at the beginning, and we talked about this in budget hearings as well as other committee hearings. You mentioned that you had 30 positions in the communications center with 9 vacancies and about, I guess, 259 in field positions with 12 vacancies. You have 17 recruits graduating at the end of November. So that's really good to hear. Can you expound on the plans to incentivize what the recruitment and retention with the 17 recruits? You have 26 vacancies. They graduate next month. What is your plans moving forward?
Well, I think, thank you for that question, Chair. And I think, EMS it's hard. It's stressful. It takes a smart person to do it. It takes somebody who's dedicated. Odd hours, weekends, nights, everybody in EMS has worked plenty of New Year's Eves, worked plenty of Christmases away from family. And, our paramedics, our dispatchers, I just can't say enough about them and how hard they work. But again, it's not for everybody. So people who enter the field and the profession, we have attrition. People decide this isn't for them. And then we have the normal attrition of people retiring and going off to other things. One of the things we've done is we've traditionally taken graduates from Kapiolani Community College, although we also take from the mainland and other places if they have the appropriate certifications. But I'd say 95% of our employees have come through KCC. I went through their program, Deputy went through their program. They weren't putting out enough graduates for us. The graduates go to other private ambulance, they go to the fire department, they go to other careers. And so a few years ago, we started our own academy to supplement the hiring from KCC. And so that has greatly helped filling the gap in our vacancies. So that's filling the bucket. But your question was more about incentives and retention. And so that's something we need to look at as well. It's something that the city needs through collective bargaining to work with the UPW on. But anything is really on the table as far as what could be done to improve the working conditions for our paramedics so they have a good work-life balance, can come to work with the passion and vigor we expect. Because I get letters every week from the community thanking our department, different paramedics and dispatchers, getting them through basically the worst day of their life. And again, I receive those every week. It makes me incredibly proud of our team. But we have, my job is to take care of them so they can take care of people.
Thank you. I will say I appreciate that. I think one thing I talked with you about this, I think when I first got into this position, was the morale, because that's one thing that I saw on some news stories is the morale being a concern for the department, and understandably so with the level of stress and demands that are placed on each individual employee. But what do you think is the morale right now?
Well, I think what I hear from the field is just the tremendous call volume is something that as administrators we need to address. And especially in town, some of the ambulances in a 12-hour shift are going on 12 to 18 calls. So that's more than 1 call an hour. And that's including get to the scene, take care of the patient, transport to the patient to the hospital, do your report, do your billing, your charges, your billing sheet, clean up the ambulance and get ready for the next call. So more than a call an hour is almost, a full-time ambulance is considered roughly a call every 2 hours is considered full-time utilization of an ambulance. So I think the key for us in this coming budget year, and we'll be talking about that in not too distant future, is actually increasing the number of units in the field to help mitigate that call volume. Other things we're doing to mitigate the call volume today is our core ambulances that had previously been federally funded. Those are transitioning to city funded, but previously federally funded, are responding to a lot of the homeless calls. So then the EMS crews and fire department, police don't necessarily have to go to all the homeless calls. The other thing is we now have 2 medical respites. We have about 75 people in those medical respites right now. These were people who are homeless with medical problems and hyper users of the EMS system. Some people were calling a couple times per week. So by getting those 75 people now in our 2 medical respites, one at A'ala and one at Liahi, those people are no longer generating 911 calls, which reduces the call volume for EMS, the fire department, and the police department. So I think the mayor's plan and program is to expand our medical respites and get more people who are medically fragile off the streets, and that will lower call volume. So those are the things we're doing. We're also using American Medical Response, the private ambulance. They are dedicating 2 ambulances to the city a day where they can, we can offload calls to them to reduce the call volume. And so I think that's a key for us, is reducing call volume per ambulance. And then the other thing is we have an aging fleet, and we are aggressively replacing ambulances over the next 12 months. We have 18, so we have 21 frontline ambulances. We have 18 newer refurbished ambulances coming in the next 12 months. So nearly our entire fleet will be replaced with brand new ambulances and or remounted boxes on brand new chassis. So I think having those, the new equipment, the new ambulances with additional units to reduce call volume, I think will help our paramedics do their job to the best of their ability.
Thank you, Director. Given, you're talking numbers, and we've had talks about this in budget about you're requesting new units. I did have questions though. If you still have a retention and retainment problem and you're trying to address it, I do have questions about how you're going to fund that retention plan. But given those concerns, how does this impact the closures? Right now you're saying that we're doing 2 AMR ambulances a day to subsidize to help us with what we need. How many closures are happening? And if you're struggling with the retention and retainment, would bringing in more units solve the problem if we don't have the people to man them?
Absolutely correct. And so, as you can see, the vacancies, I think, are the lowest they've been now probably in 10 years or 20 years. At least 10 years.
And can you, I might have asked you this before, the difference between an EMT and a paramedic? Because when you say vacancies, there's differences in what they can do. And that's another concern that I have, a question that I have. When you say this is the lowest, you have new recruits coming in, they come in as EMTs, but they're not paramedics. How many EMTs versus paramedics are in the department? And what's the difference in what they do?
Sure. So today, if someone said, I want to work in EMS, there might be some prerequisite classes, but you generally do about a 4 to 6 month class through KCC, through our own EMS academy at the city, or through another college or program on the mainland. But you can become an EMT in 4 to 6 months. And you can start with us. You can be a partner with a paramedic on a paramedic ambulance, but that gets you in the door at EMS. Generally, EMTs work for 1 to 3 years to gain experience in EMS and then go to paramedic school. In Hawaii, KCC is the paramedic school. It's a 1-year program. So from the day you say, I want to be a paramedic, to the day you're working as a paramedic, it's about 4 years. So the paramedics can do advanced life support. They can put breathing tubes in your lungs. They can put you on the ventilator. They can give medications, do defibrillation, what we call advanced life support. EMTs can do what's called basic life support. Use tourniquets, use oxygen. They can use an AED. They can start IVs, so they can do basic life support. One of the strategies we're looking at and moving towards is when we look at our call types, about 1/3 are basic life support. Yet we have 21 advanced life support ambulances. So I think over the next, we're doing it right now, but especially over the next few years, we think adding basic life support ambulances to the system will be advantageous for a few reasons. One is because those 1/3 of calls that aren't advanced life support, the basic life support ambulance with 2 EMTs on it rather than an EMT and a paramedic or 2 paramedics can take care of that call just fine. Still needs an ambulance, still needs 2 trained people, but they don't need the highly trained paramedic. The other thing is when you have our advanced life support ambulances, let's say in the town area that are so busy, adding that basic life support ambulance will reduce some of the call volume for the paramedics.
How many EMTs versus paramedics do we have in the department right now?
120? Ian's looking up the exact number, but roughly it's about 140 paramedics.
To how many EMTs? Is it
I want to get you an
267?
exact number. Approximately 105.
105. And if you have 2 EMTs in the unit, and then you said for the most part, 1/3 of the calls are that, what if there's an event where you need more than just two EMTs, and what happens? You have a paramedic come in?
That's one of the reasons why we're adding the paramedic SUV rapid response units for 2 reasons. Another thing from the slides that we had up there is roughly, I don't know, maybe 1/3 of our calls we don't transport. They don't even need an ambulance. They just need somebody there to check them out. So one of the things that is so good about the SUVs and why we plan on adding more of those in the next budget year is if it's a minor car accident, we can send the SUV paramedic, and that paramedic then does the check, writes the report, but the person doesn't need to go to the hospital. We don't need an ambulance. Now, at the same token, if one of the basic life support ambulances goes to a call and it looks like it's going to need advanced life support, that paramedic SUV then can co-respond with the BLS ambulance and then just hop on and do the paramedic skills.
Before I turn them, thank you for answering that. Before I turn it over to the members, I did have just a couple more questions back to the unit closures. Can you give me an average of how many units are being closed per week? How many are closed today, and how many are closed usually on average a weekly basis?
You know, roughly during like Monday through Thursday, a lot of times it's 0. And then on Friday, Saturday, Sunday, we usually have 1 to 2. And that's why it's really key that we have those extra ambulances from AMR and CORE to help cover in the event that we have closures. The other thing is—
So no more than 2 closures a day?
No, there's rare occasions when we have up to 5, but that's rare. I would say it's rare. And it's usually on the midnight shift when the call volume is a lot lower. What's interesting is our dispatchers, because we have mutual aid agreements with the federal fire department, and they have ambulances, as well as AMR, they have a lot more ambulances than the 2 that they dedicate to us. We can call them if they're closer to a call when we may have closures, and then they can respond. That system, and those are through mutual aid memorandums of understanding or agreement, but what we've done is we've analyzed when we have closures and don't have closures, and the response times don't change. Our average response times are not generally longer when we have closures and don't have closures. That doesn't mean it's okay. It doesn't mean I'm okay with it. But what it means is our dispatchers are skilled enough that they can utilize those mutual aid agreements.
So you're saying that closures don't impact a call being answered time-wise, distance? You're saying even with the closures, your response time is the same?
The data says that it's the same.
What data is that?
The data when we look at, like, let's say we look at a weekend with no closures, what the average response time is, and we look at a weekend with 4 closures, the response time data for both days is the same.
What's the average response time?
We could get you that.
Okay.
Yeah.
So today,
and it's different from town than Kahuku, for
you're
instance.
saying usually Monday through Thursday there's 0, so there's 0 closures today?
I could let you know.
Okay, because I hear different numbers. I hear 0, 1 to 2, and then up to 5.
Yeah, it's very variable.
And if AMR is covering 2, that means we're still deficient.
Yeah, so you know, I think night before last we had 1 overnight. I remember.
And it's usually the overnight, you said.
That more so than the day. Yes.
And why is that? Is it the personnel or the ambulance?
I think what happens is when we have people that are hurt, sick, on vacation, we rely on people to come back for overtime, And I think, this is just my guess, is overtime is more attractive for people on the daytime than it is on the nighttime.
Okay.
It's more attractive during the week than it is on a Sunday.
Okay, thank you. Members, do we have any questions? Yes, Councilmember Say.
So, Dr. Ireland, are you part of the task force in regards to e-bikes?
I am.
Great. Would it be possible then to ask the state legislature when a measure is enacted at the county level in regards to regulating e-bikes, that we get, instead of $5, maybe $10 for EMS on the vehicle weight tax or the registration tax fee? It's for discussion. You know what I'm saying? I'm looking for revenues on behalf of what the city needs. You see what I'm getting at?
I do.
Because you folks are there, taking care of that moped rider or that e-bike rider or whatever, right? And they're not paying anything. Yes. That's why I'm asking you, you're part of the task force. Would that be a topic for consideration?
And I think bikes may be registered at the city and county of Honolulu.
$5.
So that's one issue. But I definitely think we could potentially ask for more revenue on the car tax, although again, I hate to burden people driving with more money that they have to pay for a car. So it's this balance, but
No, I'm not
one
saying
thing,
the automobile, I'm talking about the e-bikes now, because they will have to be registered also.
and, right, and I think that's part of the task force, and I'll bring that up. That actually might be at the, and actually Councilmember Tam may have some, he's on the task force as well. One thing I will add is the state legislature did give us, from our ask, $500,000 in our budget this year to supplement care at Wahiawa. And what's happening, because the hospital ER opened without a hospital, anybody who needs to stay overnight at Wahiawa, Queens Wahiawa, is being transferred to other hospitals. And EMS, as well as AMR, has seen a tremendous spike in the number of requests for transfer, patients from hospital to hospital. And so we did receive $500,000 from the state to help us with that added responsibility that we've taken on.
I was going to ask you, I hope it's in perpetuity, right? The other question I have, which I don't know if the administration has discussed it, is there a possibility of researching and investigating if all three not enforcement, but critical services department, HFD, HPD, EMS, if there is a major shortage in the area of communications? HPD has a shortage of dispatchers also. You folks have, etc. HFD, I really don't know. But consolidating all three offices into one, which then alleviates some of the shortages that we may have. I'm not trying to put more work on these particular individuals who are in their place today, but at any accident or incident that occurs, they always tease you folks, the residents. When I say they tease you, they tell me, hey, Mr. Say, it's always HFD who is first, and then HPD, and then EMS, right? I'm just trying to figure out at what point in time the dialogue and the communication can occur that if we're going to have a shortage category in that area of dispatchers and communications employees, that if you could all come together as one, even though you're separate responsibilities, but it's one, tying it in and working together. It's just for the future, for something for you folks to think about. And I'm just trying to find a way to balance the mayor's budget for next year. Think about it.
Thank you, Councilmember. And you know, all of the communications personnel are in the JTMC, Ocean Safety, EMS, the fire department, and the police department. And one of the things I think that could complicate what you're suggesting is that's actually 4 different unions. Our members are in the UPW, fire is in the fire union, and lifeguards is a separate bargaining unit than the police dispatchers. The other thing too is the training is significantly different. And you know, I know when Ocean Safety was part of our department, those lifeguard communications dispatchers, you could say puka pants, you could say marijuanas, log cabins, and they just knew all the shore breaks, around 100 of them, all around the whole island. Whereas our dispatchers, EMS, do medical advice on the phone, how to deliver a baby, how to stop bleeding, so it's a little bit different. But definitely communications, you saw we had 9 vacancies out of 30 approved positions. So that is actually our biggest delta as far as percentage. So that's going to be, we have a working group with our dispatchers to see how we can close that gap, because that's actually the priority for us as well.
So in closing, Dr. Ireland and Deputy Director Sante, thank you very much in running your particular department. A lot of the residents of District 5 are very happy with the rapid services that you do provide. So I just wanted to say thank you on behalf of the residents of District 5 that I do represent.
Thank you, Councilmember. Just in closing, to address one more of your comments. We purposely will call the fire department on medical calls when they are to a certain level of critical nature. And they do get there first, and we do have them come with us because they have something like 42 stations compared to our 21. So just in numbers, they have more. They also are trained at the National Registry EMT level. They can do basic life support and defibrillation. So we have a great partnership with the fire department. And Chair, finally, I'm hot off the press, we have 0 closures today.
Thank you. Good to hear. Members, any further questions? They were okay. Director Ireland, when you do have closures, do you know which areas? Council members say that his area is really happy with the response time. I don't know if that's the same sentiment in my area, I'll be honest. So what areas are impacted when the closures occur? Which areas are greatly impacted?
The dispatchers and the staffing personnel try to be, I guess, fair, if you will. On the days that there's 4 or 5, which is, again, very rare, they won't make all of them on the windward side. They won't make them all in central Oahu. They try to distribute that geographically around the island so we don't impact one area more than we should. Like, we wouldn't close like 3 ambulances on the west side of Oahu. When there's 1 or 2, they're usually in town, because our supplemental ambulances from AMR and our BLS unit we put on every morning that's not counted in the regular tally, the core ambulances, they're all in town. And they all start generally at 7 or 8 in the morning. And so that, if we have a town closure, that's mitigated by all those extra resources we're putting on first thing in the morning.
Thank you. And who decides which ones are going to be closed on a daily basis? Is there like a master plan that happens every day, and you see how many closures, and then you decide which areas will have the closures?
Usually our staffer, in conjunction with our Assistant Chief of Operations, will make the decision. The other thing is, if it does, again, exceed a certain threshold, then I have the ability to force mandatory recall. I can also, and I have asked our administrative personnel who may be competent paramedics to actually work in the field. Myself and another chief, because I'm still licensed as an EMT, so myself and our Assistant Chief Operations worked an ambulance in town for 6 hours last week just to help out. So we do have a mechanism in place to bring and essentially mandate people to cover if I think that there's going to be any risk to public safety.
Okay, good to know. So just so I understand, because I know that, and I still have to take the field trip down to the station in my part of my district. But so is it similar to PD and HFD, where they have a station that they report to, and then that's their area? And if so, if there's frequent absences in the area, somebody comes from another part of the island, another station, is that what happens?
So yes, so generally everybody has a station, and then they have an area surrounding that station. But, like for instance, even on a normal day, Kaneohe, Kailua, and Waimanalo are our windward ambulances. If all 3 of those ambulances go out, and maybe they're bringing a trauma patient to town where they're not going to be in their area, our communication staff can move an ambulance from town to go sit at Castle Hospital to kind of cover the area. Or they can bring Kahuku, maybe move them to Kualoa Ranch to help mitigate a response time to cover an area. So similar to, I think, other agencies.
Okay, thank you. Members, any further questions? Okay, thank you, Deputy Director, and thank you, Director Ireland. Seeing no further questions, we'll now proceed with in-person testimony. Clerks, do we have any registered or non-registered in-person testifiers?
Chair, there are none.
Thank you. We will now proceed with remote testimony. Clerks, do we have any registered or non-registered remote testifiers?
Yes, Chair, we have one standing by.
Okay, aloha, good morning. I'm Angela Melody Young. Please proceed.
Thank you, Angela Melody Young. Aloha, Councilmember Okimoto. So I'm just going to refer to the Medicaid and Medicare services, the emergency services. So, for example, if it's a minor car accident or if it's a drug overdose, 2 medically necessary emergency interventions that need to be treated on site. I think if it's met by 2 income conditions, low income, vulnerable populations and demographics, those with state welfare benefits such as SNAP food stamps, or if they are homeless, then the services, emergency services, should be free. And with statutory provisions that could be legislated with work from the county's office and DOH or DHS, I'm not sure. It's by legal reasoning, right? And also I'll provide medically and financially sound justification with statutory provisions. If this was legislated in state law, it's possible to get federal funding to cover the emergency services. For example, HRS 346-59 is a DHS chapter about long-term support and service payment covers for medically necessary interventions as something to be funded by the Social Security Act.
Thank you, Angela. Clerks, do we have any further registered or non-registered remote testifiers?
Chair, there are none.
Okay. Seeing no other testimonies, members, we are in discussion. I would just like to thank you again for being here, and Director Ireland, Deputy Director, I think the discussion was really helpful for myself especially, but hopefully for the members of the committee. And I think moving forward, my goal is really to make sure that at the end of the day, we're providing the right and the most appropriate services to our communities. At the end of the, really when we think about it, we're all end users. If it's not us or a family member or a friend, at some point I myself, when my daughter was young, had an ambulance come to the home, and HFD was the first one to respond, but the ambulance did come. So I want to make sure that as we move forward, especially preparing for budget season, that we are aware of exactly what your situation is, what you need, what needs to be provided, but have an accurate and honest account of what is happening in the department. So moving forward, we know what we need to do to address the needs of the community. So thank you for being here. Okay, seeing no further discussion, this brings us to the end of our agenda today. Mahalo everyone for being here and for your participation. There being no further business, this meeting is adjourned.